Hello everyone, welcome to my channel where I talk about the most important and urgent issues affecting our health and well-being. Today, I want to talk to you about a condition that affects millions of babies and families every year, and that is preterm birth. What is preterm birth? Why does it happen? And what can we do to prevent it and care for the babies born too soon? Let's find out. Preterm birth is a condition where a baby is born before 37 weeks of pregnancy are completed. Normally, a pregnancy lasts about 40 weeks, but sometimes, for various reasons, a baby is born earlier than expected. This can have serious consequences for the baby's health and development, as well as for the family and the society. Preterm birth is one of the most common and serious complications of pregnancy, affecting about 15 million babies every year, or 1 in 10 of all births worldwide. That means, every day, more than 40,000 babies are born too soon. Preterm birth is also the leading cause of death and disability among children under 5 years of age, responsible for nearly 900,000 deaths in 2019. Moreover, preterm birth can have long-term consequences for the health, development, and quality of life of the survivors, such as learning difficulties, visual and hearing impairments, and chronic diseases. Preterm birth is a complex and multifactorial phenomenon, with many possible causes and risk factors. Some of the known causes include infections, chronic conditions, multiple pregnancies, genetic factors, and environmental exposures. However, in many cases, the exact cause of preterm birth remains unknown. Preterm birth can occur spontaneously, or it can be medically indicated due to complications that threaten the life or health of the mother or the baby. Preterm birth is not only a medical problem, but also a social and economic one. It affects families, communities, and health systems, especially in low and middle-income countries, where the majority of preterm births and deaths occur. The burden of preterm birth is also unevenly distributed, with higher rates among disadvantaged and marginalized populations, such as those living in poverty, conflict, or remote areas. Preterm birth can also exacerbate existing inequalities and vulnerabilities, as it can impose significant financial, emotional, and psychological costs on the affected families. The good news is that preterm birth can be prevented and managed, and many lives can be saved and improved with existing, cost-effective, and evidence-based interventions. These interventions include providing quality antenatal care, promoting healthy behaviors, preventing and treating infections, providing corticosteroids to mature the fetal lungs, ensuring safe delivery and essential newborn care, supporting breastfeeding and kangaroo mother care, and providing neonatal intensive care when needed. However, these interventions are not universally available or accessible, especially in low-resource settings, where there are gaps in health, workforce, infrastructure, equipment, supplies, and policies. To address these challenges and to raise awareness and action on preterm birth, the World Prematurity Day is observed every year on November 17th. This is a global initiative that brings together parents, health professionals, researchers, policymakers, and advocates to share their experiences, knowledge, and solutions on preterm birth. The theme for this year's World Prematurity Day is Together for Babies Born Too Soon, Caring for the Future. The aim is to highlight the importance of keeping parents and babies together, and empowering and supporting families to care for their preterm or low birth weight infants. The World Prematurity Day is also an opportunity to celebrate the achievements and progress that have been made in reducing preterm birth and improving its outcomes. For example, the global preterm birth rate has declined from 11.1% in 2010 to 10.6% in 2020, and the global neonatal mortality rate has dropped from 23.3 deaths per 1,000 live births in 2010 to 17.4 deaths per 1,000 live births in 2019. Moreover, several innovations and initiatives have been developed and implemented to improve the quality and accessibility of care for preterm and low birth weight infants, such as the Toolkit for Small and Sick Newborn Care, the Every Newborn Action Plan, and the Survive and Thrive Global Development Alliance. So, what do you think of this issue? Do you know anyone who was born preterm or who has a preterm baby? How do you support them? Let me know in the comments below. And if you liked this video, please give it a thumbs up and subscribe to my channel for more health-related content. Thanks for watching, and I'll see you next time.